Hello everyone. In this video I am going to explain embolism. What is embolism? Any detached solid liquid or gas molecules that gets dislodged from its original site, carried through the circulation to a distant site, and where it can cause the infarction. It is embolism basically. There are many types of embolism. There can be pulmonary embolism, fat embolism, air embolism, amniotic fluid embolism. But in this video I am going to explain pulmonary embolism in detail. Now, first of all, we have to understand what are the reasons behind pulmonary embolism. In the previous video, I have explained deep vein thrombosis. In that video, I have explained how deep vein thrombosis can cause the pulmonary embolism. In this video, I am going to explain it one time more. Like, if we are having thrombus in our any deep vein, like popliteal vein, iliac vein, femoral vein, any deep vein, then there is the risk of that thrombus to get dislodged from that side and gets into the circulation, and through the inferior vena cava it comes into the right atrium, then into the right ventricle, and through the pulmonary artery it can go into the lungs, and in the lungs it can cause infarction depending upon its size. So second thing comes here is size of thrombus. If we are having a huge sized thrombus, then there will be a huge amount of necrosis here because of a large size of thrombus. Now, if the thrombus is of medium, like average size, if thrombus is of average size, then there can be hemorrhage, like there can be raised pressure, there can be some serious effects. We are going to understand it in detail. Now the third thing comes here is paradoxical embolism. What is paradoxical embolism? Paradoxical embolism is consider if as I have told that there can be some deep vein thrombus which can gets through circulation into your right atrium, then right ventricle. Now if there is any any intra-atrial or intraventral defect, wall defect, then this thrombus can move here to left atrium, then left atrium to left ventricle, or from here to left ventricle, and it will go into the systemic supply. So the first symptom is tachypnea. Now we are going to understand it in detail. Consider this is an alveoli and this is our capillary, and now our thrombus is right here. Now what happens? Ventilation is all right, like we are ventilating at normal rate and oxygen is right here, but perfusion is defective, like our blood face some turbulence in flow. Very small amount of blood is reaching here to get ventilated, so perfusion is not right. So basically we are having low ventilation is right, all right, but this perfusion is not right. So the overall value rise, and there will be increase in alveolar arterial gradient, like here will be increased oxygen gradient and arterial gradient will be low. So there will be ultimately increased alveolar arterial gradient, which now which will now which now will lead to a condition which is known as hypoxemia. Hypoxemia means low oxygen in our blood. Now we know whenever there is less amount of oxygen, there is less partial pressure of oxygen in our blood, a message is sent to our medulla, and medulla starts sending message back to the body that we should ventilate at higher rate. So what happens next? We to compensate this hypoxemia, there will be increased ventilation. So increased ventilation is known as tachypnea. So this is how tachypnea happens in pulmonary embolism. Now the second thing comes here is dyspnea. How this dyspnea happens in pulmonary embolism? this platelet plug is right here in our capillary. It sometimes starts secreting some granules from it like ADP, thromboxane, and these products causes vasoconstriction and bronchospasm in lungs. So that's how dyspnea happens. Dyspnea occurs in pulmonary embolism. Now the third thing comes respiratory alkalosis. As I have told, there is a condition which is known as hypoxemia, like there is low oxygen tension in our blood. The message is sent to the medullary center, and medulla starts secreting messages like to increase our ventilation rate. Now if the ventilation rate is high, we know the problem is not right here in ventilation. Problem is actually in perfusion. So we are taking more and more oxygen and getting rid of more and more carbon dioxide. So this means we are getting rid of carbon dioxide. Carbon dioxide is getting low. Now we know that carbon dioxide has inverse relationship with our pH, blood pH. So a condition known as respiratory alkalosis will occur. This is how respiratory alkalosis occurs in pulmonary embolism. Now hemoptysis. Here is the thrombus. The blood faces difficulty in passing. Now blood start accumulating here. It can cause lysis of blood vessel here before this structure. And now if the hemorrhages occur, there can be cough, there can be the blood in cough. That's how hemoptysis occurs. Now bronchospasm and vasoconstriction, I have told you that sometimes our this platelet plug, this thrombus, this embolus will start secreting some granules like ADP, thromboxane, which can cause the vasoconstriction and bronchospasm. And now come to the early symptoms, very early symptoms. Like if there is deep vein thrombosis, like in some person there is deep vein thrombosis, there can be the swelling, tenderness in that limb, in that patient. They can be at some time there will be some swelling, pain, tenderness, and then that thrombus will embolize from that surface and will get into the pulmonary circulation, and that's how it causes pulmonary embolism. This was all about the pulmonary embolism. Now we are going to understand another thing, that is saddle embolism. If the embolus is at some bifurcation of main lung artery, consider this is heart, this is right side, this is left side, and now there are lungs. Now what happens? We know that there is some blockage in the bifurcation of main artery. Here is the blockage. Now what happens? The blood was coming from the right ventricle through the artery, to the pulmonary artery, to lungs, and now the thrombus is lying here. What happens next? There will be increased in pressure building in right ventricle. So there can be the right heart failure. How the right heart failure occurs? When this thrombus is here, it can raise our systemic vascular resistance, and now this systemic vascular resistance is increased. Now the heart has increased in afterload, like it has to push the blood against high pressure. So what will happen? There will be a right atrial dilation, right ventricular dilation, and the right ventricular dilation. Now consider if here is right ventricular dilation. Now the blood here is increased afterload. Blood starts moving back. We know here is superior vena cava, so there can be jugular venous dilation. This is basically the saddle embolism. What happens? We know that whenever the thrombus is at the middle of the bifurcation of a main artery, then there can be increase in systemic vascular resistance, which can lead to increase in afterload and increase in blood pressure, that can lead to right ventricular dilation and ultimately lead to the jugular venous dilation. So this can also be a symptom in pulmonary embolism. Now we are going to see what happens with the pulmonary emboli. Most of the pulmonary emboli gets organized in our pulmonary vessels. So there is basically organization, and there is only a presence of small web, fibrous web, indicating the embolus. Now the second thing comes, if the embolus obstruct our middle-sized arteries. There will be no infarction because we know our lungs has dual supply. They has the bronchial supply as well as pulmonary supply. So there will be no infarction, but there can be hemorrhage due to increase in systemic vascular resistance. There can be increase in pressure before that point. Now the third thing is embolic obstruction of end arterial branches. Like if it is obstructing some capillary, then there can be the right heart failure and there can be the hemorrhage or infarction. And multiple emboli causes pulmonary hypertension, which can lead to right heart failure, as I've explained before. Like here there is an embolus in our vein, and which will lead to the hypertension. Systemic vascular resistance will be increased, which will lead to the hypertension, and there will be the right heart failure. So this was all about saddle embolism. Thank you for watching. Bye bye.